Well, if you struggle with those unsightly veins, you are not alone.
No, vein disease is common in older adults, but there are ways to prevent getting it and ways to manage it if you haven't.
Our Brogan Morris explains.
Hey guys, it's Brogan. What's good for you? I have vascular surgeon Dr. Eileen de Grandis with us today, and we are going to go over a really important topic, and that's vein disease. So first off, tell me what it is.
Vein disease is any dysfunction of the venous system, and when I explain vein disease to people, I like telling people it's a big part of your blood vessel circuit. So arteries bring blood down from your heart, and veins bring it back up to your heart, and any problem with the bringing blood back up to your heart is vein disease. So it can encompass reflux, which is the veins pull blood down instead of up, or it's blood clots.
So how would this impact somebody's life?
Well, blood clots are very dangerous. So if you have a deep vein blood clot, it can cause heart and lung problems, potentially death. So that can definitely impact life significantly. And venous reflux, what we call the dysfunction of veins where they don't really bring the blood back up to the heart, can cause a lot of swelling, discomfort, discoloration, open sores and wounds, and unsightliness, which is hard for us in Florida because we wear shorts all the time.
But something that you can maybe help get rid of that.
So definitely with the venous reflux, we can do what we call ablations, where we get rid of the dysfunctional veins. I can make small incisions and microsurgery to remove dysfunctional varicose veins. And we can also do things like sclerotherapy, which are injections to get rid of spider veins, which again, are very unsightly, especially if you want to wear a skirt in summer.
So what are some of the risk factors for vein disease?
Risk factors, genetics. Often it runs in families, but if you don't move a lot, if you don't exercise, your legs can swell. Vein disease is often a disease of time. A lot of older patients have it just because the valves that work in the veins age with you, and they start to cause dysfunction after the age of 60. So that's most of our population here in Florida.
Yes, it is. So what are some of the things that maybe you could do to prevent it?
Compression stockings. I'm wearing compression stockings right now, but that helps a lot. Exercise, elevation. I tell everyone over the age of 40, when you sit down, put your feet up on the coffee table. It's what it's for, not coffee, just your feet.
Wow. Okay, I could start doing that. That's easy peasy. When I just sit back and kick up.
Sit back and kick up. Turn on your favorite TV show and watch it for a few hours.
That's great. Is there anything that I didn't ask that you maybe want people to know about vein disease?
I think vein disease is very treatable. I think there's a lot of misconceptions that people have to live with it, especially with older patients who've had, seen older doctors who don't treat it. But it's definitely very treatable, and there's a lot of options, but go to someone that you trust.
Okay, and actually I do have one more question. For someone living with it, how do you manage it?
So compression stockings are great. We talked about kicking up your feet.
Right.
But you can.
So those things kind of just help relieve it?
Those help relieve it. If you have wounds or sores, wound care is really important. Keep preventing infections, preventing the swelling that can cause breakdown of the skin. If you have blood clots, blood thinners are really important to take consistently so you don't have more blood clots to form.
Okay, great. Well, thank you so much. This information was so helpful. And guys, if you have any more questions, we will have this up on our website for you, cbs.com. So thank you for your time, and that's what's good for you.